What are triglycerides? Brought to you by allaboutloweringcholesterol.com, the leading cholesterol-lowering website visited by more than 1 million people per year. Simply, triglycerides are what we call fat. When you grab a handful of tummy, love handles, or some other fat storage, you are grabbing triglycerides. Triglycerides transport the fat in the blood from one place to another. They're also the storage form of fat. Triglycerides are derived primarily from the fats you eat, or made by your body from excess calories. These fats provide you energy and have many other important functions in your body, such as heart muscles all the time, and for all parts of the body except your brain. Regular monitoring of your triglycerides will help prevent many diseases. A simple lipoprotein profile is conducted to measure triglyceride levels. What are normal and high triglyceride levels? Having normal triglyceride levels is important to stay healthy and prevent heart disease. To measure your triglyceride levels, you simply need to do a lipoprotein profile. This is a simple blood test to measure the levels of triglycerides and cholesterol. Triglycerides less than 150 milligrams per deciliter are considered normal, 150 to 199 as borderline high, 200 to 499 as high, and levels 500 and above are considered very high. Whatever the case, if you have high triglycerides, level above 200 milligrams per deciliter, you need treatment, including medication, lifestyle changes, diet changes, and losing weight if obese. You can achieve normal triglyceride levels by eating healthy and simple foods, regular exercise, and losing extra weight. Triglycerides are a major source of fat stored within cells. These fats provide you energy and have many other important functions in your body. So, regular monitoring of your triglycerides will help prevent many diseases. A simple lipoprotein profile is conducted to measure triglyceride levels. The 4 causes of high triglycerides. Causes of high triglycerides are divided into 2. Those that you have no control over, and those that you can control. The 2 causes that you have no control over that can result in high triglycerides are age and heredity. Very simply, triglyceride levels steadily increase as you grow older. And some forms of high triglycerides occur among members of the same families. Don't fret over it. When you can't control something, don't worry about it. However, the following 2 causes are something that you can definitely control. 1. High-fat foods and weight gain. Triglyceride levels usually increase as your weight increases. Excess calories, especially from sugar and alcohol, are one of the causes of high triglycerides. Alcohol increases your liver's production of triglycerides and reduces the amount of fat cleared from your blood. Also, high-fat foods increase your triglycerides. High-fat foods are, for example, red meat and dairy products. 2. Medications. Certain drugs, such as birth control pills, steroids, and diuretics, water pills, can cause triglyceride levels to rise. Are there any high triglycerides symptoms? You can achieve normal triglyceride levels by eating healthy and simple foods, regular exercise, and losing extra weight. Triglycerides are a major source of fat stored within cells. The problem with high triglyceride symptoms is that they are invariably non-existent until significant damage has already been done. High triglycerides symptoms usually correlate with the concurrent disease, like heart disease, diabetes, and stroke, etc. If your triglyceride levels are found to be too high, the following 2 symptoms of high triglycerides may be observed. 1. Inflammation of pancreas, called pancreatitis. This may result in sudden and severe abdominal pain, vomiting, loss of appetite, and fever. 2. Fatty liver and liver enlargement. This is caused by the buildup of excess fat in the liver cells. If you have fat more than 10% of your liver's weight, it will be diagnosed as fatty liver. If you are eating more than you required, excess fat starts building up in the liver. Too much fat exhausts the liver's normal functions, and excess of fat starts depositing within the liver. Rapid weight loss, malnutrition, and alcohol abuse may also lead to fatty liver. In case of persistent high levels of triglycerides, the size of the liver may also increase over time. The size of the liver is usually evaluated through abdominal X-rays and ultrasound. What is the diet to lower triglycerides? According to the American Association for Clinical Chemistry, diets high in carbohydrates, especially sugar, lead to increases in triglycerides. A diet to lower triglycerides omits alcohol and sugar, as they stimulate triglyceride production. Both sugar and alcohol, fermented sugar, are a source of excess calories which are being turned into fat, usually triglycerides, so the fat levels in your blood go up. When alcohol, ethanol, is present in the blood, the liver prioritizes removing alcohol from the blood over other metabolic processes. The liver can detoxify about 1 ounce of alcohol per hour, equivalent to 12 ounces of beer or 4 ounces of wine. In the meantime, however, glucose tends to be further processed into triglycerides, which raises their blood levels. Please note that after your triglyceride level goes back to normal, you will have to follow a modified sugar and alcohol diet for the rest of your life. What are triglyceride medications and how do they work? There are a number of conventional triglyceride medications available in the market used for triglyceride lowering purposes. They are divided into two groups: statins and fibrates. Statins block a key liver enzyme involved in production of cholesterol in the liver, thus slowing down its production. Statins enhance uptake of bad cholesterol, LDL cholesterol, by the liver, removing extra cholesterol out of blood. There are a number of statins available in tablet or capsule form, including Zocor, Lescol, Lipitor, Mevacor, Pravachol, and Crestor. The second group, fibrates, are known to reduce triglyceride levels by 20 to 50%. The most common brand is Lopid, gemfibrozil. Lopid is given in patients with very high levels of triglycerides who are at risk of developing inflammation of the pancreas, pancreatitis, and blood clotting problems. While both statins and fibrates are usually safe, in some people there are side effects like gastrointestinal upsets, skin rash, sleep disturbances, headache, muscle aches, and liver disturbances. What are the 3 ways to lower triglycerides naturally? It goes without saying that it's important to lower triglycerides naturally, since high triglycerides are a risk factor for many diseases. There are 3 natural products available for lowering triglycerides naturally. 1. Niacin. Niacin, also called nicotinic acid or vitamin B3, is a water-soluble vitamin. If given at recommended doses, it can reduce triglycerides, cholesterol, and bad or LDL cholesterol, and increase good or HDL cholesterol. The dose of niacin recommended to lower triglycerides naturally is between 1,000 and 2,000 milligrams 2 to 3 times daily. As it blocks breakdown of fats, it causes a decrease in free fatty acids in blood, and thus decreases cholesterol and triglycerides in blood. 2. Fish oil, omega-3. Fish oil is often added in natural supplementation formulas for lowering triglycerides naturally. A research study has shown that fish oil supplementation is highly effective to lower triglycerides naturally. The study found an average reduction of triglycerides by 38%, and an increase of good cholesterol, HDL, in both men and women taking fish oil on a daily basis. And 3. Garlic. Garlic is used in many natural supplementation formulas. A number of studies have proved its beneficial effects in lowering triglycerides naturally as well as cholesterol. It is commonly used in the treatment of hypertension as well as in prevention of cardiovascular diseases. One study showed a significant decrease in triglycerides and cholesterol after a few weeks of treatment with garlic.